January 14th marks the first major release of higher Social Security payments for the new benefit year, and it represents a structural milestone in how annual increases are actually delivered. While the cost of living adjustment was announced months ago, this date is when millions of beneficiaries finally see that increase reflected in real dollars. The delay is not a policy change, a reduction, or a missed payment. It is the normal mechanics of how Social Security applies adjustments each year. But misunderstanding this timing causes confusion every January. The cost of living adjustment is announced in October after inflation data is finalized. That announcement sets expectations, but it does not trigger immediate payment changes. Social Security does not retroactively adjust checks in the final months of the year. Instead, the adjustment is built into January benefits. That means no beneficiary receives the increase until their first January payment date arrives. January 14th is simply the earliest large payment date on which the updated amounts are distributed to a significant portion of recipients. Social Security payments follow a fixed calendar structure. Beneficiaries are paid based on a combination of program type and date of birth. Most retirement, survivor, and disability beneficiaries are paid on one of 3 Wednesdays each month. Those born between the 1st and 10th of any month are paid on the 2nd Wednesday. Those born between the 11th and 20th are paid on the 3rd Wednesday. Those born between the 21st and 31st are paid on the 4th Wednesday. This system has been in place for decades and does not change from year to year. In January, the calendar alignment matters. Because January 1st fell on a Thursday, the 2nd Wednesday of the month falls later than usual. That pushes the first major payment wave to January 14th. In years when January begins earlier in the week, the 2nd Wednesday may fall closer to the beginning of the month. This year's calendar placement makes the wait feel longer, even though the underlying payment rules are unchanged. The January 14th payment wave affects an estimated 20 to 25 million beneficiaries. This includes retirement beneficiaries, survivors, and individuals receiving Social Security disability insurance, whose birthdays fall between the 1st and 10th of the month. From a financial perspective, this is one of the largest single-day benefit distributions of the entire year. Tens of billions of dollars are released at once, reflecting both regular monthly benefits and the newly applied cost of living adjustment. The adjustment itself is 2.8%. That increase is applied to the gross benefit amount, meaning the total benefit before deductions. However, most beneficiaries do not receive their full gross benefit as a net deposit. Medicare Part B premiums are deducted directly from Social Security checks for most enrollees. For the new year, those premiums also increased. As a result, while the cost of living adjustment increases the benefit, the Medicare deduction reduces the net amount deposited. This interaction between COLA increases and Medicare premiums is one of the most misunderstood aspects of Social Security payments. Beneficiaries often expect to see a clean percentage increase in their deposit. Instead, they see a smaller change and assume something went wrong. In reality, the increase is present, but it is partially offset by higher healthcare costs. The adjustment is real, but the net effect depends on individual deductions. It is important to distinguish between gross benefit increases and net payment changes. Social Security calculates COLA based on inflation and applies it uniformly to benefit amounts. Medicare premiums are calculated separately and deducted afterward. When premiums rise sharply, they can absorb a meaningful portion of the adjustment. This does not mean the COLA failed. It means the overall cost structure for retirees changed at the same time. Supplemental security income operates differently. SSI payments are not issued on Wednesdays. They are normally paid on the first of each month. When the first falls on a weekend or federal holiday, the payment is issued on the last business day of the previous month. Because January 1st was a holiday, SSI beneficiaries received their January payment on December 31st. That payment already included the cost of living adjustment. This is why SSI recipients saw their increase earlier than other Social Security beneficiaries. It is not preferential treatment. It is simply the result of a different payment schedule. SSI is always the first program to reflect annual adjustments, followed by Social Security payments that roll out over the Wednesday schedule throughout January. January 14th is only the first wave. Beneficiaries born between the 11th and 20th will receive their updated payments on the third Wednesday of the month. Those born between the 21st and 31st will receive theirs on the fourth Wednesday. A smaller group of beneficiaries, including those who began receiving benefits before May 1997 or who receive both Social Security and SSI, are paid on the third of the month under a separate schedule. Understanding this structure is critical because it prevents false assumptions. A missing increase in early January does not mean a payment was skipped. It means the payment date has not arrived yet. Social Security does not issue partial increases or stagger adjustments within a benefit. Each beneficiary receives the full adjusted amount on their first January payment date. This timing also explains why some people believe others received increases sooner. Different birthdays lead to different payment dates. Different programs follow different schedules. None of this reflects eligibility differences or processing delays. It reflects long-standing administrative rules. January is always a high-volume period for Social Security. It combines new benefit amounts, updated deductions, tax document preparation, and heightened beneficiary attention. Questions spike every year because expectations collide with the reality of the payment calendar. The system itself remains consistent, but the calendar creates the perception of inconsistency. The January 14th payment should be evaluated carefully. Beneficiaries should review the gross benefit amount, confirm the COLA was applied, and understand how deductions affected the final deposit. Comparing the new gross benefit to last year's gross amount provides the clearest confirmation that the adjustment was applied correctly. This first wave sets the tone for the rest of the year. Once a beneficiary receives their January payment with the updated amount, that amount becomes their new baseline. All future monthly payments for the year will reflect the same structure, unless other changes occur, such as Medicare premium adjustments, income-related deductions, or eligibility changes. January 14th is not a special bonus date. It is not an early release. It is not a policy shift. It is simply the first large-scale payment date on which the new benefit structure becomes visible for millions of people. Recognizing that distinction removes confusion and replaces it with clarity. As these payments begin rolling out, it is also important to understand that January often creates heightened expectations because multiple financial changes occur at the same time. Cost of living adjustments, Medicare premium updates, and annual tax reporting all converge within a short window. When several changes happen simultaneously, it can feel as though something is missing or incorrect, even when the system is functioning exactly as designed. Taking a moment to separate each component and review them individually helps prevent unnecessary concern and allows beneficiaries to clearly see how their benefit is structured going forward. The key takeaway is timing. The increase was announced months ago, calculated carefully, and applied exactly as designed. The calendar determines when each beneficiary sees it. January 14th is the first major checkpoint, not the finish line.